Hello everyone, welcome back once again. So we will be continuing with the foundations of radiation safety. So in this session, I'll be discussing about the introduction to the radiation safety. As we know, there are two types of radiation, ionizing radiation and non-ionizing radiation. So ionizing radiation can remove electron from an atom, creating charged particles that is called ions. It can damage the cells, cause abnormal function or cell death. Also useful for diagnosis and treatment when controlled or used appropriately. Protection is essential to minimize unnecessary exposure to patient as a technologist for us and for the public as well. As we know, ionizing radiation has sufficient energy. It is having a high energy to remove electrons from atom, that is breaking the binding energies and producing ions and causing biological damage to the human tissue. So ionizing radiation removes electron from an atom and causing chemical and biological changes. There are two types of ionizing radiation you can see here in this table: electromagnetic radiation as well as particular radiation. Electromagnetic radiation include X-rays and gamma rays. Particular radiations include alpha particles, beta particles, neutrons and protons. When we come to non-ionizing radiation, this radiation also have the energy, but it does not have enough energy to remove electron from an atom and therefore does not cause ionization. So there is no ionization happening by the non-ionizing radiations. So types of non-ionizing radiations are radio wave, microwave, infrared rays, visible light and ultrasound. The next part is the biological effects of radiation. What all are the biological effects which can cause? So biological effects of radiation are changes in the body cells and tissue caused by the interaction of ionizing radiation with atoms and molecules. So radiation damage occurs at three different levels. It can happen at molecular level, it can happen at cellular level, or it can happen at organ level. So what is molecular level? Direct or indirect DNA damage through free radical causing chemical bond breakage. Cellular level, DNA strand breaks and chromosomal damage leading to cell death or mutations. At the organ level, loss of many cells produces clinical effects such as skin burn, bone marrow suppression, cataracts, sterility, and cancer. When we come to the broad classification of the effects, first one is stochastic effect and deterministic effect. First one is stochastic effect. Stochastic effect is the effect occur by chance or are unpredictable. You can see from the graph there is no threshold at all. So even the smallest radiation dose can cause an effect, and probability increases with the dose. So as the dose increases, the probability of stochastic effect increases, but severity is independent of the dose, which is caused by DNA damage and mutations due to improper repair. Main outcomes are cancer, that is somatic effect, and genetic disorder, germ cells effects. So we have to know what is somatic and what is genetic effect. Somatic effect is nothing but effects that exposed individual, leukemia or cancer, which is happening if I am getting exposed, the cancer is occurring in me within my lifetime. That is somatic effect. So the individuals who is exposed, the cancer is happening in that particular individual itself. That is called the somatic effect. And genetic effect, it is affects future generations. So successive generation it will be affecting, example birth defects, hereditary diseases. All this included the examples of genetic effect. So when we come to the deterministic effects, deterministic effect occur only after a threshold. You can see in the graph there is a threshold. From that threshold itself it is starting. So after a threshold dose of radiation is exceeded. So below the threshold no visible effects is seen in deterministic effect. So severity increases with increasing dose. So caused by massive cell death and tissue damage. Examples involving skin burn, cataract, radiation sickness, sterility, etc. So types of deterministic effect include early and late. Early is nothing but acute, so occurs hours to week after the exposure, that is skin erythema, epilation, blood cell depletion, acute radiation syndrome, etc. And late chronic occur months to years after the exposure, such as cataract, that the radiation dose if it is greater than 2 gray, fibrosis, reduced fertility, that is beyond 2 to 5 gray. When we come to the acute radiation syndrome, the acute radiation syndrome is nothing but which occurs after a whole body exposure, not into a particular organ or a part. It is the whole body exposure to a higher radiation dose, higher ionizing radiation in a very short period of time. That is called acute radiation syndrome. So types of acute radiation syndrome include hematopoietic syndrome, that is between 1 to 10 gray it is happening, and gastrointestinal syndrome, it is between 6 to 10 gray, and cerebrovascular syndrome, it is happening at the level of 50 gray. When we talk about acute radiation syndromes, we have to remember 4 stages, which include prodromal stage, latent stage, manifest illness stage, and recovery or death. Prodromal stage is nothing but you can be able to see some symptoms such as nausea, vomiting, diarrhea, fatigue, leukopenia. This kind of symptoms you can be able to see. But in latent period, it is exceeding about 1 week time. So in this period, you may feel that I am all right, I am becoming better. So there won't be much symptoms there, or you will be having slight symptoms of that prodromal stage, but you may feel that you are feeling better. But immediately after the latent period, there is a period which is called manifest illness stage. So the drastic changes in the symptoms you can see in this phase. The initial phase, whatever symptoms you had at the prodromal stage, that symptoms will exaggerate in the manifest illness, and also it can give you confusion, dehydration, vomiting, severe diarrhea, fever, infection, hemorrhage. All these excessive symptoms you can see in the manifest illness stage. And at the end, there is the fourth stage, which is called recovery or death. Recovery in 3 months or death at higher doses, 6 to 10 gray. You can able to see in the graph that below 0.5 to 1 gray you can see radiation effects at the blood count level, but when it goes to 1 gray or more, it can lead to the acute radiation syndrome, and 1 to 10 gray you can see hematopoietic syndrome and gastrointestinal syndrome, and above 50 gray you can able to see the cardiovascular cerebrovascular syndrome. So with this, I am concluding this session. The acute radiation syndrome, you can see that hematopoietic syndrome, I already mentioned about that, it is happening between 1 to 10 gray. You can see also, which is also called bone marrow syndrome, and decreased in RBC, WBC and platelet counts, and causing anemia, infection and hemorrhage. And survival is around 6 to 8 weeks if it is greater than 2 gray, and survival improves with bone marrow transplants. And gastrointestinal syndrome, it is more severe. This is 6 to 10 gray, so severe nausea, vomiting and diarrhea. And the main thing that you have to remember here is that damage to GI epithelial lining. So GI layer it will start destroying by this kind of excessive radiation. And also what happens, whatever the bacteria which is useful bacteria within our body, that itself causing harming you. So that is the condition it is happening here. And latent period is up to 5 days, death in 3 to 20 days without treatment. If it is not treated, 3 to 20 days the death will happen. And also cause of death can be fluid loss, and infection that I mentioned. Infection due to the bacteria, the useful bacteria will start infecting you. And cerebrovascular syndrome, which is happening at the level of 50 gray, affects brain and also cardiovascular system, and which is giving you confusion, loss of conscious, and become going to coma stage, and fluid intake, fluid leakage into brain. It's causing edema, and also death within hours or 2 to 3 days maximum. So final causes CNS, and also CNS failure, or it can be due to cardiac failure. That's all about radiation syndromes, early and late radiation effects, somatic and deterministic effect. Thank you one and all.